Familia. It's a pleasure to be with all of you today. I'm Dr. Ilan Shapiro. I serve in AltaMed for the past 7 years, and I'm the Chief Health Correspondent and Medical Affairs Officer, a practicing physician in the community. And it's a pleasure completely to be with you today. As we know, we have been through a lot, and it has been heavy for all of us. And every time that we hear vaccine, new, innovative, booster, we have certain knee-jerk reactions that probably we can actually improve. And a lot of the conversations that we have, especially with the communities that need this type of protection, sometimes are tough. And they are tough sometimes because of the hard reality of having a couple of jobs, the language barriers, cultural barriers, or other things. And today I'm going to be talking with you regarding a very important topic about how AltaMed and how are we trying hard to make sure and share a couple of learnings from what we have seen from the past couple of years and how we're trying to apply that to our community. Wanted to share a couple of things regarding AltaMed. AltaMed was founded a couple of years back, 1969. We have been on the community for a couple of years, and most importantly, we serve around 500,000 patients, and we are in the places that they needed the most help. We are there with underrepresented communities, underserved communities, communities of color, and sometimes the community, when they see us differently. We are part of that trusted list of messengers where we have their time and we are very honored to serve them. Why? Because between jobs, the daily life, and all the other stuff that we're having, it's tough. It's tough, and the time that they spend with us needs to be very well received. Part of the things that I want to share is the reality of our community, and I invite you to check PBS documentary "We Are Where We Live" because it gives you a sense of where we are serving, all of us, and the importance of being there in the community. In the old days, we had the thought that our patients needed to come to the community, to the clinics. But right now, we know that we need to go out there to the community, to the places that they need us. And it's not that they are serving us; we are actually serving them. Then having that mentality of someone that is like a waiter, someone that is actually perceiving the needs of his patient. That's the most important thing. In the old days, we were like, oh, we are open from 8 to 5, and whoever comes in, that's awesome. We know that if we actually want to reach our community, we need to make differences. We need to open our doors. We need not just to do that, go to churches, go to schools, go to community events in order to capture anybody that can be helped or start a conversation. As we know, part of the feelings that we're having as a community is the part of imposing things. We need to change that. Part of the important things is starting conversations, and everybody has a different way to do this. One of my best recommendations is to make sure that you are starting a conversation and you see yourself not as that healthcare provider, but someone from the community. We all want the same. We want to be safe. We want to be secure. We want to make sure that we're doing the best things for us. But we need to make it in a cultural aspect of this, from our clinics to the community. In our clinics, starting that conversation, making sure that we are on the same page. I can share with you that when I started vaccinating my kids, I needed to look for information to make sure that the numbers were there and have that balancing act between what was expected to protect my kids. I vaccinated my kids after reviewing that part, and a lot of parents actually need that trusted messenger to share what's their personal story. Why are they doing this? It's very important to open the doors and share what are the side effects, what is expected, what's normal. And also, no matter what's the solution for the patient, letting them know that we are always here for them. Sometimes they need to go and talk with family members. Sometimes they need to review things, or sometimes they are ready to make the next step. But we cannot label anybody. We cannot call them anti this or in favor of that. It goes above and beyond. We all want the same thing, familia. We want to be safe, we want to protect our kids, and we want to make the best decisions. But they are coming from a different place where they get snippets of information, social media stuff. And a lot of the times, there's not enough information to share a clear message. There's not enough information to do a clear decision. And what happens? We get paralyzed. And that's why a lot of the efforts that was done here in AltaMed, and it was an amazing, amazing effort. It was created something called Andale que esperas. Right now, the website is still alive, but it's not being updated. But it gives you a really trusted sense of getting to the culture, getting to that point where we know our community and bringing actually messengers. And that cartoon is actually from a very trusted Mexican cartoonist, and also a character called El Chavo. El Chavo was part of absolutely most of anybody in Latin America that was born there. It had a lot of conversations, a lot of opportunities, and a lot of trust on the community. Then, whenever you can, just go to that website. You will see him actually talking about vaccines, and that it's okay to be afraid, and it's okay to have questions. But the most important answer that he gives us is why we need them: to protect ourselves, to protect our bodies, and to be present with absolutely everything that we have in front of us. That's why, familia, we need you. We need you to be that trusted source of information, to bring that cultural aspect of opportunities to our community, and make sure that we have an open heart for absolutely everybody. And I know that it's tough. We're tired. There's a lot of things going on. But at the moment that we have a patient, someone from the community in front of us, and we have the opportunity to share information, it's up to them what will be the next step. But if we're not there, we know who is going to be there. There's going to be disinformation, misinformation, and other things. That's why it's so important that we are all united with this, and we're singing the same song. And the song is, "We're here for you. We're going to give you information, and whenever you're ready, no matter what decision, we will always be with you." Please, familia, thank you so much for hearing me. Un abrazo enorme. And if you need any information, we're always here to help you in AltaMed. Make sure that you connect with us. And thank you so much for your time, and have a beautiful, blessed day. Bye-bye.